Good evening and welcome to the COVID-19 pandemic update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Ondo State Commissioner for Health dies of coronavirus. Governor of the state orders all closed aids to go for compulsory test. Ahead of school resumption, University Don gives advice on safety measures for students and teachers. And Gabon bars European travelers into the country in retaliatory move following lockdown restrictions on COVID-19. Now, 406 persons have been discharged from various isolation centres across the country in the last 24 hours, putting the total number at 10,152, even as the nation recorded more cases of COVID-19, with the NCDC's announcement 790 cases in 20 states and the Federal Capital Territory bringing the total figures to 26,484. According to the Nigeria Center for Disease Control, NCDC, 13 deaths were recorded in 24 hours, putting the death toll at 603, while total active cases stand at 15,729. A regional breakdown of the figures in Nigeria sees Lagos in the southwest with 10,630 cases. The FCT in the north central, its figures at 1,935. Kano tops in the northwest with 1,257. You have Edo State still leading in the south-south with 1,165 cases. Gombe is now ahead of Bauchi and other states in the northeast with 507 cases. Ebonyi tops in the southeast with 438 cases. Ondo State's Health Commissioner Dr. Wahab Adigbenro has died as a result of complications arising from COVID-19. A close source told Channels Television that he died today at the Federal Medical Center, Owo, in Ondo State. A native of Ilara, Mokin, Ifedore, Mr. Adigbenro, before his death, was involved in the campaign and enlightenment of Ondo indigents on the coronavirus safety protocols. A two-time health commissioner, he doubled as chairman, Ondo State Interministerial Committee Against COVID-19. Earlier this week, the governor of the state, Rotimi Akeredolu, on social media confirmed that he tested positive to COVID-19 and had ordered all his close aides commissioners to test for the virus. Now, the Presidential Task Force on COVID-19 in its briefing today warned civil servants not to entertain visitors who are not there on official visits. The chairman of the task force and secretary to the government of the Federation, Mr. Boss Mustafa, also clarified on directives on reopening of schools. He insists that only graduating students are permitted to resume in preparations for their exams. Mr. Mustafa also reacted to the attack on the FMC Lokoja.
For the avoidance of doubt, schools have not resumed and schools have not opened. Only critical examination classes will be allowed to resume for those who need revision before examinations. As we have informed you, the Federal Ministry of Education will consult further with stakeholders before issuing guidelines that will lead to full resumption for the examination classes. In the briefing for Monday, mention was also made about government offices, without prejudice to the additional guidelines that will be issued by the head of civil service of the Federation. The following generally applicable guidelines are to be observed. As much as practicable, virtual meetings should be encouraged to minimize congregation of officials. 2, government offices should restrict visit by those who are not on very essential businesses to their premises. The Presidential Task Force has received with great concern Reports about the attack on the Federal Medical Center Lokoja in Kogi State by some hoodlums. The Presidential Task Force is particularly distressed and regrets the trauma to medical workers, patients, and others who went on their legitimate businesses were subjected to. I wish to assure you that security agencies have been tasked with the responsibility of fishing out the criminal elements behind it, and they will be brought to justice.
Delta State in 24 hours recorded the highest number of COVID-19 infections following the announcement by the NCDC, which put it at 166 of the total 790 confirmed cases, another high in a single-day infection in Nigeria. Total confirmed cases in Delta State stand at 1,131, but active cases are at 918. 190 persons have been discharged and sadly 23 people have died. In the last 5 days, from Saturday night up till Wednesday night, except for Tuesday, Delta has seen a daily rise in cases, totaling 350 confirmed cases. On Tuesday, it did not record any case, but neighboring Edo State saw cases rise at 119, a single-day infection. As at Sunday, when the total cases were 912 in Delta, the local government breakdown showed the highest cases from Oshimili South, Uvie, Warri South, Uheli North, and Sapele in that order, with over 2,500 tests done and 98% contact tracing. But of course, today those numbers have risen. For more on the rise cases coming there from Delta State, we have the Chief Medical Officer of the Federal Medical Center joining us from Asaba, Dr. Victor Osayatuma. We'd like to thank you for joining us on the program. CMD, what are we experiencing in Delta State? Is it more testing, why we're seeing more cases, or is it less compliance with the preventive protocols on COVID-19?
Well, thank you for having me on your program. It's sad that we're having these large figures being turned out. But I want to say that the figures we are having is not different from what we already know. What we're having is a community transmission, which is going on in most of the states. But because we have stepped up testing, and I think the reason we're getting these figures is because we're doing more testing now. So we're fishing out all the people who before now thought they were free. Quite a number of them are asymptomatic. Some have just mild symptoms, but a lot of them who are asymptomatic were tested because they were exposed. Either you came in contact with somebody who just decided to test. A lot of them are asymptomatic. But the truth is that the community transmission is on and is happening in almost all of the states. And as we are stepping up testing, we may even pick up some more.
At what point do you see Delta State reaching its peak?
Well, I would think we are getting close to our peak because we are aggressively pursuing it. I think we're getting close to our peak. We on a daily basis are picking up 4 or 5 patients presenting at the emergency, and then you test them, some are positive, and all those who manage, you test them, a lot of them also test positive. But quite a number of those cases also that are being reported, I think are some are follow-up cases. They're not all entirely new. Some are follow-up cases that we are testing for discharge. And some of them, even after treatment, are still positive. But we do know that after 14 days, even when they are positive, they're not capable of infecting people.
We'd like to thank you, Chief Medical Officer of the Federal Medical Center, Asaba, Dr. Victor Osayatuma. Thank you for joining us on the program.
Thank you.
Well, let's take you right now to Abuja. We heard from the Secretary to the Governor of the Federation clarifying on the directives of reopening schools. We have the senior lecturer, Department of Petroleum and Natural Gas Engineering, that department, the Bayes University, Dr. Akali Ibrahim. He joins us from Abuja studio. Glad you could join us on the program. Now, in your opinion, are schools ready to reopen? And this is especially students in graduating classes, even if it's just to prepare for their examinations.
Thank you, Millicent. Yes, to a large extent, I think the time is ripe for a phased opening of the schools, particularly for those students that are exiting JSS3 and the senior level. For those that are exiting, actually, from this method, we can possibly pick some lessons on how best we can open up the schools. And this is the partial reopening that a lot of us have recommended, have supported partial reopening, because I think now it's really important that we look more on the side of opening the schools, and again, more on the side of how best we can abide by these COVID-19 protocols, because that is what is done in other sectors. Almost everything is open, interstate travels, public places, and all that. All that is required is to enhance observance of the COVID-19 protocols. Of course, wearing of masks, you can't get into the schools unless you wear your mask, temperature checks, and physical distancing, and hand sanitizers, and all of that. So I think it's really important now that we come to terms with the fact that it's really the time is ripe. The time is ripe to begin to think on possible full total opening of these schools. But then, of course, it's also, I'm not saying the government is out of point by enhancing consultation. Of course, government needs to consult. We also have to bear in mind that these are cases, these are issues that involve children and non-adults. So it's in line for the government to consult widely with experts before this opening. But I think, to be honest, at this point, it is very clear that the time is ripe to begin a phased opening of the schools.
Is online not an option? And this is when we see some of other countries who have reopened, and the fact that the virus also resurfaced in several other countries outside Nigeria. So there are certain fears by lots of parents and a lot of people with regards to school reopening. Are we saying that this is a necessity now? Can't these examinations be conducted online, for example?
Yeah, well, Millicent, I would have wished that would be the case. But, last time I was here, we were discussing about this online, and very clearly, really, our educational system, our educational infrastructure doesn't have the capacity to, take up this online. Maybe for private schools, private universities, but if I'm being conservative, I will say that only about 10, 15, 20% are online now, as far as the schools are concerned. So if you can conduct an online exam for private schools, private universities in Abuja or in Lagos, can you do that in Gudo local government in Sokoto State, or in Goron local government in Sokoto State? You find out that you could have actually a whole local government where you couldn't identify a teacher who has a working laptop. Where is the power? Where are the... So that is the reality.
All right, Dr. Ibrahim.
Capacity to absorb this online is not there. So we really shouldn't amplify on online. Let's look at what is on ground. Let's look at the reality. Let's look at the facts, and let us, tailor our programs, our opening programs based on our affordability.
We'd like to thank you, Dr. Akali Ibrahim, Senior Lecturer, Department of Petroleum and Natural Gas Engineering, Bayes University. Thank you for joining us on the program. In much of Africa, but also in the most developed parts of the world, much about the coronavirus pandemic is unclear, including the knock-on health complications it may cause and how far it has actually spread. The figures cited that measure the extent of COVID-19 in Nigeria and elsewhere in Africa generally indicate a low level of spread. According to the World Health Organization, much testing is still conducted in cities with the exception of Gabon, South Africa, and Ghana, which is taking testing to the hinterlands. Nigeria, with about 200 million people, has conducted just under 140,000 tests as of today. Nigeria's coronavirus spread had initially been concentrated in Abuja, Lagos, and Ogun states at the beginning, but that soon changed with more confirmed cases and the advent of community transmission. The Channels TV COVID-19 monitoring dashboard gives us a breakdown of the figures, and we're looking at Nigeria, the confirmed cases, the active cases, and that's when you subtract the recovered and those, sadly, that we have lost at that number. But let's go back to talking about where it is happening. That is the epicenter, Lagos State. Lagos is seeing a high number of cases, and this is spread across different local government areas. We begin with Etiosa. That is recording about 1,515 cases. This local government area covers a couple of local councils, development areas, including Ikoyi, Obalende, Etiosa East, and Iru, Victoria Island, LCDA. If we go by 2006 census data, that's very far indeed. The area has a population at that time of about 300,000, but that since, of course, has definitely enlarged from then. But due to its being the former location of the nation's capital, Etiosa is home to a number of domestic and international businesses. It's also people there, mostly into fishing, farming, and trading. The next highest local government area in Lagos State is Alimosho. Alimosho is seeing about 663 cases. It has the largest local government by population, and we also have the record of about 1.2 million, the figures as at, of course, the 2006 census. But other estimates say that over 2 million, with regards to what it is, might be now. Confirmed cases, and in terms of confirmed cases there, we're looking at 663. Koshofe is next, the third highest, 659. We have Ikeja, that's also seeing another high in terms of COVID-19 cases at 620. But one other thing we're also seeing are some local government areas that have less, that have reported less cases, and you see areas like Ekpe and Badagry. We'd like to bring in a guest to join us now. He's joining us via Skype to give us perhaps an explanation to why indeed Lagos seems to be recording a high number of cases in its community transmission stage. We have the Deputy Director of Research, Nigerian Institute of Medical Research. He's also the Head, Infection Control and Biosecurity, Dr. Gregory Ohinhoi. He joins us now via Skype. Thank you for joining us on the program.
Always a pleasure, Millicent.
All right, let's begin with what you noticed from the cases we're seeing in Lagos. Apparently, Lagos is recording a daily rise in cases, but we're seeing a lot more in some of these locations, local government areas like Etiosa, Alimosho, than perhaps other areas. Why is this?
A good question, Millicent. Now, you must understand that Lagos will certainly remain the epicenter for obvious reasons. One, Lagos has the highest population in the whole of the country. Two, most of the initial cases that came into the country, were either from Lagos or close to Lagos. Initial case actually came from Ogun State. Remember that this virus was virtually imported from outside the country, and in Lagos, you have the busiest international airport in the whole of the country. So it's obvious that Lagos will always take the lead. So by every variable. But what is also important is that we have to compare states in terms of per capita contribution. So if we are looking at Lagos State, having the lion's share, over 45% of the total cases we have in the country. But remember also that Lagos State is home to over 10% of Nigeria's total population. So if you look at per capita sharing of this burden of the disease, you will discover that it will cancel itself out. If you look at population for population in terms of the disease, you will discover that probably the spread may be virtually uniform, and we need to analyze the data to look at that in terms of the per capita contribution. Now, two, let's break it down to Lagos. If you look at the local government they were talking about that is taking the lead in terms of local government distribution within Lagos, it's obvious that Etiosa is ahead. But remember that Etiosa is home to where you have, some of the elite businesses, like you rightly stated in your introductory statement, the elite businesses, where you have the people that virtually came into the country, people who have the capacity and the means to travel. So the early cases were probably domiciled in the Etiosa local government. And so the spread started from there. But I know that very early in this pandemic in Lagos, we had this nest of infection that took place in Alimosho area. So that has been growing steadily. So in other words, I would say that the first person that got the infection, or the first local government that got exposed, would definitely remain higher than other local governments. So that's why you are seeing the picture that you're looking at now.
Okay.
In the Lagos.
Just because we have Doctor, just because we have just a few seconds before we go on, and this is to quickly ask you, perhaps if you can, in 30 seconds, with Lagos decentralizing, sample collection, testing capacity being ramped up, what will happen when flights resume, when borders are opened?
Now the possibilities are that, one, when borders are open, definitely the infection will move across these regional borders, state borders, and go to other countries, other states, I mean. But I'm not so worried. Like I said, the spread along the country in terms of per capita measurement is almost uniform. So that's why I'm in support of the fact that lifting the border across states and also allowing flights to resume makes a lot of sense, because the infection has spread around, the pandemic has spread virtually around the nation. And so there's no state, as it were, that is really spared. Even the states that are claiming to be spared, like Kogi and probably Cross River, we know that there's a lot of controversy in those states. So every state has received, its fair share and fair burden of the disease. And when flights are open, there will be movement across the border, the movements across the states, but it will not really juggle the dynamics of spread as it is currently. So it will not significantly negatively impact the spread.
We appreciate your time, Dr. Gregory Ohihoy, Director of Research at NIMA. Thank you for joining us. Now, the NCDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory. The website comes alive with all the information and statistics, depending on where you are in Nigeria, with regular updates. The World Health Organization's website has live updates as well, the spread of the pandemic across the world. You can see the public health response at national and subnational levels. Of course, take a closer look at our website, channelstv.com. You can see news there in health, politics, sports, all from Africa and the rest of the world, channelstv.com. That's the COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now.